From the stables of Medic Echoes, we bring you yet again another health information. It is the 19th of June, which is commemorated as the World Sickle Cell Awareness Day. The theme for this year is Let Us Shine the Light on Sickle Cell. The goal is to increase the knowledge and understanding of the sickle cell disease and to discuss the challenges faced by the patients, their family, and their caregivers.
Sickle cell disease are a group of inherited disorders which affect the red blood cells. It is a genetic condition, which means it is passed on from parents to the offspring.
Sickle cell disorders causes normally round and flexible red blood cells to become stiff and sickle-shaped, stopping the cells and the oxygen which they carry from moving freely across the body and causing pain.
This can cause episodes of severe pain and other complications. These painful episodes are generally referred to as sickle cell crisis, which can be very excruciating and unbearable.
Complications that can result from sickle cell disease are stroke, acute chest syndrome, infection, blindness, bone damage, priapism, which is a persistent painful erection of the penis. They may have leg ulcers, even pulmonary hypertension, and many other conditions.
What are the types of sickle cell disease? There are several types of sickle cell disease, of which the specific type a person has is dependent on the genes which they inherited from their parents. Examples are hemoglobin SS, hemoglobin SC, and hemoglobin beta thalassemia. Others include hemoglobin SD, hemoglobin SE, and hemoglobin SO.
There is also a sickle cell trait, which is the hemoglobin AS. Of more concern is the hemoglobin SS, which is the serious form. This form occurs when an individual inherits two sickle cell genes, that is the gene S, from both parents. This is called sickle cell anemia.
On the diagnosis of sickle cell anemia, it is done using a simple blood test that detects the presence of an abnormal hemoglobin protein in the blood. Those who are diagnosed of sickle cell anemia often may require regular testing using blood and urine to be able to monitor their condition.
Patients may also receive transcranial ultrasound screening, a painless procedure that uses sound waves to examine blood flow in the brain. It helps doctors assess the risk of stroke and start treatment to reduce the risks.
The treatment is varied depending on the complications experienced. Pain medications are given to prevent or treat pain, proper or adequate hydration to prevent crisis or other complications, and folic acid to help the body in the production of new red blood cells.
Antibiotics to treat infection, vaccination against certain diseases that would be risky to those with the sickle cell disease, blood transfusion for those with severe anemia and also to prevent stroke, and last but not the least, bone marrow transplants might also be indicated for those with severe symptoms.
Well, the only cure for sickle cell disease or sickle cell anemia is bone marrow or stem cell transplants. The role of genetic counseling. For those who are diagnosed with sickle cell traits or parents with children diagnosed with sickle cell anemia are often referred to genetic counseling, which will help guide in making conscientious and balanced decisions.
This helps prospective parents in determining the probability of future children inheriting the disease and thereby helps them to make fully informed reproductive decisions.
Let us shine the light on sickle cell.
Let's shine the light on sickle cell.
Let us shine the lights on sickle cell.
Let's shine the light on sickle cell disease.